In Health Watch, the U.S. is continuing to evacuate hundreds of Americans from China while also facing an immediate threat on the Northeast shores. The Anthem of the Seas came into port in Bayonne, New Jersey, just outside New York City, with at least a dozen passengers who will be tested for signs of coronavirus. There are now more than 31,000 confirmed cases worldwide, and at least 638 people have died, including a Chinese doctor who tried to warn the world a month ago. CBS News Asia correspondent Remy Inocencio has more.
China is being massively rocked by anger and grief right now with the death of Dr. Li Wenliang. The government had accused him of spreading rumors. We now know that to be false. He has been vindicated in his death, along with the 31,000 infections and counting around the world. Meanwhile, there are 2 cruise ships that have been quarantined, including the one right here in Hong Kong behind me, as well as one in Yokohama, Japan. There are nearly 8,000 people quarantined, and the fear is that coronavirus is spreading.
On board the Diamond Princess, health officials cautiously removed another 41 people, their tests for coronavirus positive. The past 2 days, this massive luxury ship has been quarantined in Yokohama, Japan. 3,700 people may have been exposed to the highly infectious disease. Jenny Jorgensen from Utah watched from her balcony as the sick were taken away.
Then we found out that we were going to be on 14-day quarantine.
Stressed passengers described rising tensions between health authorities and people who say they aren't being told if and when they might go home.
I was devastated when we got the news. I was crying pretty hysterically because we have kids, we have jobs.
In the city of Wuhan, the epicenter of this crisis, nearly 60 million people are still on government lockdown. The healthy have been told to stay indoors and to report violators, their neighbors, anyone to the police, while the suspected sick still cram into hospitals, running short on supplies. This video from social media, which CBS News can't independently verify, claims to show this warehouse now converted into a quarantine center. The infected lying helpless and in close proximity with claims of no bathrooms, no running water, and no doctors. When asked who was in charge, this woman replied, "No one." More social media from inside shows disappointment, even anger. And on the outskirts of Wuhan, frantic efforts to contain the virus have now yielded 2 hospitals built in just the past few weeks to isolate and treat the infected, praised by government officials on state media.
And the screws keep tightening for any traveler coming from mainland China, just a few miles away from here in Hong Kong. The government has said actually that anyone crossing that border will have to be put under a mandatory 14-day quarantine, and anyone exhibiting any symptoms, fever as well as cough, could have to wear a GPS monitor. Vlad?
Ramy, thank you very much. Is CBS News medical contributor Dr. David Agus. Good to see you, Doctor.
Morning, Vlad.
So many people are comparing the symptoms to the symptoms of coronavirus to having the flu or flu-like symptoms. How does this virus actually compare to the flu?
It's a great question. So coronavirus is a common virus. You know, about 1/3 or more of common colds are of the subtype of coronavirus. And so, you know, when you get this one, this Wuhan one, which is a more aggressive virus, you get a cold, but it's predominantly in the lung, not the sinuses and elsewhere. And that lung, it's your immune response to it. That inflammation builds and builds to make it very hard to breathe. Most people get over it. We have drugs now that seem to be efficient in treating it. The problem is in countries that don't have developed health systems, like in the middle of China, what you're seeing is chaos because they can't care for the people with supportive care. The United States, I don't think that's going to be a major issue.
You know, it's so heartbreaking when you read that the doctor who tried to warn people about this virus way back in December succumbed to the disease or succumbed to the virus in just the last couple of days. And could it have been, could this, I don't know if it's an epidemic or a pandemic, I don't know what the medical term is, but could this spread of the virus have been prevented if the Chinese government and more people had paid attention to this doctor back in December?
You know, he's a hero. I FaceTimed with him in Davos a week and a half ago.
You did?
And I was talking to him, and he had no symptoms at the time.
Wow.
And we were talking, trying to understand what was going on with this virus. So, you know, to speak up against your government and say something has happened and to risk going to jail really, to me, is an absolute hero. Yes, if the Chinese government intervened earlier, this would not be happening in China and elsewhere on the globe. And so the earlier you intervene with a public health epidemic, the better the outcome is going to be. That's clear. Remember, in 1918, 85 million people in the world died of the Spanish flu, which, by the way, started in Kansas and not Spain. And we stopped it by basically cordoning everybody off. You couldn't meet with 3 or more people in the United States. Churches were closed, synagogues, movie theaters, they were all closed, akin to what's happening now in China. It works to cordon people off, but the earlier you do it, the better, because once they get out and get into Beijing, when they get into Tokyo and other cities, they start to spread it there.
You know, it's so interesting to hear you call this doctor, and I want to say his name because a lot of people are saying what you're saying, doctor. They're calling him Li Wenliang a hero, and that is what I'm seeing from reporters who are based in Beijing, Western reporters, and other individuals who are saying that within Chinese social media, he is trending, and a lot of people are calling him, just as you did, a hero.
And he's an ophthalmologist. And
right.
He just noticed, hey, this doesn't seem like a regular virus. You know, people with the flu have this. This seems different. And he pushed him saying something is happening. We have to test this virus. And the government listened but didn't act and then started to quiet him. And yeah, he's a hero for stepping up. We need more people to be aware and talk.
So there are some, though, who have also suggested, look, is there too much, or asking, is there too much of an emphasis on this coronavirus here in the United States? You know, there's breaking news alerts whenever we learn that somebody here might be affected with the virus, when we do not do breaking news alerts when somebody is affected with the flu or dies from the flu. All told for this year, how many people are expected to die from just the common flu in the United States?
Approximately 40 to 60,000 people.
40 to 60,000 Americans will potentially.
40 to 60,000 Americans, young, middle-aged, teenagers, 20-year-olds, 40-year-olds, 80-year-olds will die of the flu in an average year.
So why is that not, I mean, what is it that is so interesting about the coronavirus and what is happening versus what is happening here and has been happening for many years?
We've become numb to the flu. We've accepted it. Most people in this country don't even get a vaccination, which can temper the flu or eliminate it so you won't die of this horrible virus. When there's something new, it raises our alarm bells. And, you know, in a sense, if this happened here in the United States, it could at least double our deaths from viruses a year and overload our systems. I mean, I get emails every day now from all the hospitals in LA. We're at capacity. Try not to do elective admissions for surgery or anything because of the flu, right? They are full. We add another virus to our system, it can be near breaking point. That being said, we got to fight what we got here.
Right.
It's astonishing to me that every person isn't vaccinated for the influenza virus. Makes no sense.
And that is your message to people who may be seeing the news alerts about coronavirus and worry about it. You want to say, worry about the flu and get a flu shot.
It's not my message, it's my mandate.
Your mandate.
You know, I really believe is that, you know, it's not just you. If you get the virus, the flu, most likely is, by the numbers, you're going to survive. But if a friend of yours is immune suppressed or on cancer therapy and they get it from you, you can kill them. You know, we got our country to stop smoking by the argument of secondhand smoke. It's not just you, it's what you do to your community. The same is true by not getting that flu vaccine. So don't just care about yourself, care about others. Get that vaccine. At the same time, we need to be aware of things like the coronavirus. The American work ethic is, you are sick, get into work no matter what. And what you do is you spread it to everybody else. You feel sick, you should stay home. The other thing that really gets me is that, you know, if you feel sick, most people aren't tested for things, right? When you're sick, you normally just rest or you take fluids or you take some Tylenol. You don't actually get tested. So the numbers for everything we're talking are way underestimated because most of us aren't tested. Wouldn't it be neat if you could test yourself at home and just, you know, have it picked up by Uber and delivered to your doctor and they told you you have influenza?
I wouldn't trust me with any kind of test. Yeah. But yeah, I mean, it would be remarkable if you could be able to. You don't like to sit in a doctor's office where everyone's coughing on you and everything you touch can give you something else. We need to change how we do testing in our country and worldwide. All right. Well, I'm a hypochondriac, so I'd be testing myself for a lot of things. But this is a great mandate message.
We can talk about that if you want. We have medicines and.
You also have a degree in psychiatry. Dr. David Agus, good to see you. Thank you very much.